UnitedHealthcare sues dialysis chain over billing. That gaping price difference was the motivation for a scheme, orchestrated by a for-profit dialysis chain, that illegally pushed poor people in Florida and Ohio out of inexpensive government programs and into expensive private plans sold by UnitedHealthcare, according to a lawsuit the giant insurer filed in federal court on Friday. UnitedHealthcare says the arrangement needlessly exposed the patients to medical bills. The suit accuses American Renal Associates, a public company that operates nearly 200 dialysis clinics across the country, of fraudulently billing millions of dollars since the beginning of the year. UnitedHealthcare is trying to recoup that money. The insurer argues that the effort was aided by the American Kidney Fund, a nonprofit patient advocacy group, which paid the patients premiums for private insurance. The insurer said American Renal Associates earmarked donations to the Kidney Fund to pay for the coverage, violating anti-kickback laws in the process. The lawsuit also says that the company's patients were not told that the Kidney Fund would stop paying their premiums if they received a kidney transplant. The Kidney Fund, which is not listed as a defendant in the lawsuit, is overwhelmingly financed by dialysis companies. American Renal Associates said on Friday that the lawsuit was without merit and that the company would vigorously defend itself. At all times, we are dedicated to putting patients first, and we structure all of our relationships within that framework, Michael R. Acosta, Vice President and General Counsel, said in a statement. The American Kidney Fund declined to comment on the specifics of the lawsuit, but said it was deeply troubled by the allegations of what it described as improper use of its program by a dialysis provider. Continue reading the main story. The company says it keeps contributions from providers separate from decisions about whether to offer assistance to patients, an arrangement that it said was affirmed by the federal government in 1997. In a statement, its chief executive, LaVarne Burton, said that the group did not recommend particular facilities or insurers and that nearly two-thirds of the 79,000 patients receiving assistance from the fund were on Medicare. The assistance the fund provides, she said, is a lifeline for people who depend on dialysis for their survival. The suit, filed in United States District Court for the Southern District of Florida, touches on an issue regulators have focused on in recent years, the role of third parties paying for insurance. Federal and state regulators have expressed concern about payments made by outside groups that are closely tied to industry, where the goal appears to be less about helping patients than about generating profits. This week, the top insurance regulator in Idaho said insurers could refuse payments from organizations like the American Kidney Fund. Minnesota made a similar decision in June. There are third parties out there just trying to help people, said Dean L. Cameron, director of the Idaho Department of Insurance, citing religious organizations as an example. But the practice becomes problematic when the funding is tied to the doctor or the facility providing care, he said. Those kinds of arrangements concern us. The dialysis industry has come under scrutiny from federal regulators in recent years for a variety of actions, including overbilling Medicare. Many dialysis centers say they lose money because the government programs pay them so little. People who need dialysis and have end-stage renal disease are eligible for Medicare coverage, even if they are under 65. If they are poor, they may also qualify for Medicaid, which covers nearly all out-of-pocket costs. Patients may be enrolled simultaneously in both programs.